My people, it is Tuesday the 17th. T-Hubs has wrapped up his work, and I am still waiting. Because I was supposed to meet up with his boss, so I could get some stuff from him that he needs for tomorrow, and this is becoming a all-day, 2-day actually, event. Trial of errors, if we will. Because he neglected to think about the fact that when he agreed to meet me yesterday, he had to also pick up his daughter from a train, arriving in town from a train, Amtrak. And today he was supposed to take her out to go do stuff, and here it is, 7:30-ish at night, 7:40. Little boy Blue just left. And I thought I would have a video filmed and ready to upload for you guys today, but no, because nothing really went on. Went by Walmart really quick. Got 2 tests, and I'll tell you why. I had a cycle that started, I don't have my tablet to tell you the date, but it was about 7 days ago. I think I mentioned in the other video, I had like 1 day of spotting, like very extremely light spotting. I mean, I could have dipped my fingers in food coloring and went like that onto the pad or anything. I wasn't using a pad, but you know what I'm saying. And it would have looked like that for the day, the whole 24-hour period. That's funny. 24 hours, and then nothing for like a day and a half, if not 2 days, and then 2 days of the same type spotting, but it got slightly heavier to what it would be true spotting. First it was brown, then it was red, then it was a smidgen on that 3rd day to literally 24-hour time frame again, like if I took a dropper and went beep with 1 drop. That's it. So, I don't know what to say about that, because after that, there was nothing again. 1 day of the spritz type spotting that I didn't even need a pad or a tampon. Literally, I put it in the 1 day, and that's only because I had to be out that day and do a lot of the stuff, and I didn't want, if the witch was flying in town, I didn't want to not have anything in. Yeah. What the hell? Anyway, nothing. Last regular cycle was July, but everything is pretty much, and that was heavy flow. Everything from January to July was heavy flow, and not exactly every 26 days, but reasonable time frame, like maybe up to 32, 36, somewhere in there. So I was like, no, it's just menopause kicking in. But not so much. Because clearly, if all of those were super heavy, I don't see going to nothing, just beep. I don't have my sound effect for that anymore, so I have to do it beep, flatline. And then all of a sudden, hi, I get a pregnant test, which is, look back a few videos. Many positive, faint positives, and obviously the digital, which I don't have clearly because that was a few weeks back, if not a month or more. And I had 2 of them, and I filmed them on maybe the older videos, a few weeks back. And yeah, craziness because of the fact that I had digitals that even said it, and then go to the doctor and they tell me it's -1. So I have spent my entire day looking up faint or negative tests, but you were pregnant. Then I came across an interesting article that a doctor, an obstetrician, was actually talking about phantom pregnancies. Dun, dun, dun. And phantom pregnancies are actually fake ones, but she did mention something else in there. She mentioned where somebody does not get positive urine tests, and sometimes not positive blood tests, and or continues to have bleeding similar to a period, or at the time their period is due throughout the pregnancy. And they don't get a positive test for very late. And I'm talking like 4, 5, some 6 months in for their first positive. And she explained the reasons why, this, that, and the other. I don't know. I'm not going to go through all that. It's a whole nother video for another day. But basically, they call that a cryptic pregnancy. So look it up. Cryptic pregnancy. You are pregnant. you see something faint at home, but you go to the doctor and they get a negative, or you get a negative, negative at home, but you feel like you're pregnant. One lady got to the point that she was 16 weeks and she actually had the belly going and everything and felt solid and wasn't gaining weight. She's very skinny, and then she showed pictures and everything on YouTube. Just look it up, cryptic pregnancy. And showed all her tests where she had labeled them out by the dates and everything. And lo and behold, she finally got a positive at home, which was faint. Went to the doctor's office, they did a blood, it came up positive, but barely on the numbers. But then they send her for a UC, I'm gonna say UC, for a ultrasound, US. And yeah, there's a 16-weeker in there. Craziness. So don't know what to say about it. So anyway, that got me thinking. So I decided, the other thing is that when you ovulate and then the egg is fertilized, it's actually the corpus luteum. It's the cyst-like thing from the ovaries where the egg popped out of that is making that HCG initially, until the placenta implants and has developed enough that it takes over. So your HCG levels normally would climb and climb and climb, but then they start to come down because, and I think it said between 10 and 11 weeks usually for most of the videos I watched, because the corpus luteum has done it and it's like pooped out and it just can't do anymore. But the placenta should be healthy enough and big enough to take, and attached well enough to take over at that point. So your HCG levels actually drop down. That's why it's called the hook effect, because your graph goes up, 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 and then it starts to go down a little bit. So some people test around 11, 12 weeks and they got these big bold lines when they were 8, 9, 10, whatever weeks, even 4 or 5 weeks, and then they're concerned because the test started out got darker, and they're like, yay, and they got the digital, it says pregnant, and then all of a sudden they just test for the hell of it, and the lines are a lot lighter than they were before. They say the solution to that is to take your PP and dilute it by half. Water to urine. So I did one with just full out urine. It was admittedly later in the day because it was see, we got little boy blue at 4:30ish. Ran to Walmart, so it's probably like 5 o'clock in the evening, but I had a good long hold. It was probably like a 5-hour hold. And I have been peeing a lot, so that was a mission in itself. So, I'm going to show you what my hook effect is, what it's called. When it goes up and then you start getting lighter tests, you're still just as pregnant. Everything's normal. It's just the HCG, from what I listened to the brainiacs online, the doctors and the lab tech geeks, was basically that the antigen level that is on the test strip, there's a certain amount, and I believe they use mouse cells is what they call them. I don't know. But whatever that little antigen or whatever you call it on the strip that would give you the positive on the line, it binds with HCG. But it's only within a certain threshold of a level of HCG. And I guess when you're that high, sky high, and you're 10, 15, 20 something thousands of HCG as a beta, basically the test isn't designed to read something with that much in it, so it kind of like short circuits the test antigen strip or whatever, and basically that's why it looks like a lighter line. But they say that if you dilute it 50% urine to 50% water, it actually will give you a darker line, and there were tests where they showed the before and after doing it. So I decided to test that myself today. So let me flip this camera on round. Be right back. Okay, so I don't have, this is just a couple of the older tests. I'm actually going to put them in order in a moment. Let me figure out where my flash went. There we go. So I have never ever, it's like one of those games where you have to drink when you never ever did something. Hopefully this will show up, because I did go back and watch a couple of my earlier videos, and it kind of irritated me that the lines, I can see them clearly here while I'm filming, but on upload, for some reason, I'm using the highest quality I can when I upload from my phone to YouTube, it has diminished. These are some of the faint ones that I got, but this is a Dollar Tree up top. And I can tell you, them are some non-sensitive MFers right there compared to your Wally World and your Frere. First response, early results. And even to the clear blue, even though a lot of people don't like the blue dye. So you can see there's a second line on that one. I'm having to use my flash, so sorry about the fact it's not wanting to focus, but you're looking for the color of the line anyway. Okay, and then this is a clear blue, Or it might be Wally World's brand. I'm not sure. They look really similar when you buy the generic or the regular. But you can see there is a vertical line on the one on the left. Well, it's my left. I don't know if it's going to flip when I upload. But let me get rid of this flash for a second. Come on, focus, you bugger. Okay, so there's a second line there. I'm going to tilt it or do the tilty whirl thing. A lot of people hate blue dyes, but these lines would be there when they were wet. This is back from October 8th, so I've been getting these for a long time, people. And let me get some of the other ones out here. Actually, let me get to the point. Next to that is the hook effect thing. Now, if you look at this one I just did a couple hours ago this evening, not first morning urine, yes, I know, but it was concentrated and had a ton of vitaminage in it. Vits from, so it was bright yellow urine. That's what I just showed you earlier. It's been diluted a little now for the second test, but dang it, let's see if I can get it to where you guys can see this. There is a very, 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 very faint. My nose is running like a faucet right now. Y'all, excuse me, I'm gonna sneeze. Sorry, I'm sneezing like crazy because the dogs are aggravating my allergies. Hang on. Oh, this is not gonna work out well. I might have to stop filming and go back when I can stop sneezing because I've been sneezing for an hour now. Okay, so there's a very faint line there. Second line, let me see if I can get the flash back on it. Oh, for the love, stop it. Only when I put my head down and start filming. Anyway, it's there, it's very light. Like I could see it while it was wet. But when I did the dilute one, which is marked here, hook dilute, I do not see that faint one at all. So there they are. Tilt a whirl a little bit. You'll see it somewhere in there. The top one. So hook effect did not work for me. Okay, so just to recap quickly before I put out this whole collage I have here. It would probably have been around the third week of September. Like, well, not so much. Around the 17th, 18th, something like that, that I'm going from, which I got my first, light positive, but definitely there, on Frere and First Signal, which is Walmart's brand. That was on October 5th. When I counted back on the calendar from that time, which would be the last BD time that I recall anyway, going from the latest and the last one, that would put me on October, I can't see my calendar because it's on the phone. That would have been, anyway, it would have put me right about 4 weeks when I did it. And then I just marked my calendar every Wednesday. It came up as a Wednesday. Every Wednesday to go 5 weeks, 6 weeks, 7 weeks, 8 weeks, and then all the way to 12 weeks, which would be next Wednesday, not tomorrow. Tomorrow would be 11 weeks because today is the 17th. So, being that the hook effect thing is supposed to be around that time frame, I was just curious as to, do I even still have the faint line? Because I haven't tested since they told me at the hospital that their HCG was showing less than 1, which is normal, what they said. Well, not normal if you're still getting faint lines on any and all brands of tests that you're taking. And I know about EVAPs, but you're not going to get an EVAP on every single test, and you can't possibly get an EVAP when the test literally is within 10 minutes soaking wet. So it takes longer than that to dry. So anyway, I'm going to show you the one from the hospital because I did go in there one time because I was, my asthma medicine wasn't really working and I didn't have a cough or anything like that, but of course they wanted to do that Q-tip to your brain, swab me for COVID, which of course I was negative. And anyway, the inhaler basically took care of that when I went in. But it more became an incident of my blood pressure being very high. Surprise. And it hasn't been lately. So they basically just kept me there for that, brought the blood pressure down, sent me home. But they did do a pregnancy test because when I said July 1st was my last cycle, they were like, But because of my age at the time, I was 46. I've had a birthday on November 1st, so I am 47 now. But they were like, well, you're still in that range, so we have to do a test. I'm like, go for it. So they did a urine test, which, let me pause. I got to flip the camera again. Well, no, I don't. I'm a liar. Alright, forgot I was filming towards my own face because I'm looking at myself in the mirror. I'm so smart. Alright, this one I am going to have to do a little something here for y'all. This is a hospital test, and it's actually a 10 milli international unit, 10 MIU. That is probably the most sensitive you're going to find anywhere, even on the web. These are supposed to be read at 3 minutes, and that is what they do. They do not wait till 5 minutes, like most tests tell you can check them at. So I'm going to cover this. This is basically, let me see if I can get it to focus for you guys. Hang on. This flash might be throwing it off. It's that plastic glare that's killing it right now. All right, this left little window is basically your control. It's letting you know that the test did function properly. Try to get out of my own way with this. This is why I have to have the flash, y'all. Sorry. Anyway, so you can see the control is there. That's the little square all the way to the far left. Hopefully it's on your left. That's the control. And then over here is the test area. Now, what I'm going to show you is you get a plus if it's positive, obviously, and a nothing but the blue going across if it's negative. So if I cover this up, can you guys see the vertical right there? That was showing because they did this test while I was in the room and they were waiting to see if my blood pressure would come down. You see that vertical line? And yes, it is supposed to be a different color than the blue. So there's no confusion about anything. And yeah, that is definitely a plus right there. Well, lady nurse says, hang on, get rid of this. She says, oh no, I'm sorry, it's negative. And she left the room to go get whatever she was going to get for my blood pressure. And yeah, so nosy old me, I hopped my happy butt up all wired for sound to the machines and stuff and got the rail down because I used to work in a hospital. I know how to work those beds. Don't think by putting those guardrails up that you're keeping me from getting out of that bed. I'm going to do it. I went across the room, I looked at the test myself, and immediately I said, there is a vertical line. She's crazy. And so I decided to wait until right before I left, and she said, yeah, but it's light, so we really don't consider that positive. Hello? Hello? Can you hear me? There would have to be some HCG in the system for it to give you some kind of line. Otherwise, it wouldn't have bound with the antigens on the vertical to get any kind of color to come out. So I had asked if they would do a blood test, and they said no, they don't do it unless they see a definitive, dark positive. Stupid. So anyway, I snatched this bad boy up off the counter after she left the room and procured it for my own collection. So I'm going to set the hook test stuff aside, and I'm going to show you the ones that were in my little goodie bag, that Ziploc that I opened earlier, but I need to actually, looking for the pause button, I need to pause while I go ahead and set these up in order. Be right back. Hang on, y'all. Sorry, one more break. Okay, sorry about my sink. That was from my hair dye job the other day. I gotta clean that. So anyway, I don't know the date on this one, which again, as I told you, was from the hospital. That one is right there. You can see the vertical line. Okay, these are dated, but great, I got hair on it. My hair is falling out everywhere. Okay, so this is one of the earliest ones I got. It's a first response early results. 6 days sooner type deal. I have to be precariously cautious with these because they are balanced on the edge of my sink, and some of them are off the edge of the sink just on a piece of paper. So I'll move that around a little bit so I can get past the glare of the plastic on the frare. So hopefully you can see that one there. That was the first one I got. And I did a digital, I believe. I went out and got them a day or two later. And those are in a past video. But that is the 6th, so that was the next day. And I apologize because that one actually got wet from sitting next to my sink. But you can see the difference between the two. It's definitely a stronger line. This is the 7th. which I don't know if it's AM or PM, you guys, honestly. I've been drinking so much water, I have to get up a lot in the night to go to the bathroom, which I never used to have to do, because, yeah, that's annoying for one, but I'm trying to be healthy. This is the 9th. You get that glare out of there. Now, I think it was the 9th when I did the digital, because that one is much darker than the 5th. There's the 5th, and there's the 9th. And then this is the 11th on the first signal from Wally, which the 7th was like so, and the 11th is darker, just a tinge. Now, there's the 9th, and this one is the 14th. So it almost looks a little lighter, but I do know, excuse me, that I had not held very long on this one. I just was excited to use that second one out of that pack for the Frere. So you can see both of them there. The 9th and the 10th. Not too much difference. Let's see. I know I have some more in between, like, I don't know where I put it. Oh, okay, I see it. This one was one of the Walmart cheapy, the clear blue equivalent. They look almost the same as the clear blue ones, but it's just a line test, so might be a little harder for you to see because of the blue dye factor, but hopefully I can tilt enough that you'll be able to see it. Right there. Just a vertical line. And I didn't put anything up here that was a possible evap. I've got tons of tests over there. Just some of them are so faint you aren't going to be able to see much. Okay, this one, I take it back. This is the Walmart, well, I don't know. You guys know. I'll figure it out, because I always take the ends off of them for storage sake. Sorry about the paper. I've spilled all kinds of stuff on here. But there's the two lines on that one. So that's either the Wally version of a clear blue or it's the actual clear blue. And I think the actual one is a plus. So this should be the real clear blue here. I don't know. You guys will figure it out if you've been testing as long as I have. I just don't keep the boxes and all that. So that one did make a plus. It's right there. And this one, these were all visible within time frame. This one, unfortunately, was a victim to the splatter of the hair dye the other day, so that's what that splattering is. But you can see that one had two lines easily visible, and this is on October 20th. So this is 15 days after I got the one back here on the 5th for the Frere, right there, and the 6th right there, and the 7th right here. This flash blinds everything out. And there's the 9th. That's the 11th. And the 14th. So we're looking at... Where did it go? Oh, sorry. I threw a different one in there on the date. That's a November one, you guys, that has that plus still showing up. And this is after the doctor's office they told me at the hospital that there was a negative HCG. But you can see there's still a plus. There's the 20th of October. So we're back in October, you guys. Sorry, I didn't have a place to put that one because it was falling off. So the 20th of October is still going strong. 22nd looks a tidge darker than the 20th. And this one was on the 25th. It was the last Frere that I took, which admittedly started to look lighter. And by now I had been calling every doctor and clinic around here trying to get on progesterone, and no one would put me on it. So if you look at the 25th, and here's the 14th, there's 11 days difference, but the lines are not significantly that much different. I mean, you could tell the 14th is definitely the darker of the two. Come on. And this one is the 25th of October. So again, this would be the blue dye from November 7th. That's one of the most recent ones, other than where I did the little hook effect thing earlier today, which was, pardon my marker in the way. There's just no way for me to get this. I can't get this one to show very well, guys, but it is right above the T there. I don't know how far away to go for you guys to see it. It's very faint. It's fainter than any of the other ones. So I'm not inclined to say that there's anything but the rent going on. But, oh God, the flash, I keep forgetting. Where's that button at? Hang on. I can't see. All right, here we go. Sorry, you guys had to look at my shoulder there for a minute. Nose is so completely done. I'm raccoon-eyed because I put this makeup on early this morning. Oh, earlier this afternoon, not this morning. But, and my skin is so greasy. So I don't know what to say about that, because when I started reading about all those cryptic pregnancies and people were going up to like 16, 18 weeks before they got their first positives, I was just like, what's the hell? So I tried it out. So I don't know. The hook effect thing didn't do anything darker for me as far as that faint that I saw earlier. So I'm not going to claim that at all. I still have not had a regular cycle, and I don't have any symptoms other than the fact that I did check my cervix for the first time in forever. Yeah, forever. And it was so high, I could not even reach that bad boy. I mean, I had to do all kinds of yoga positions and, like unnatural positions to try to get to it. I did eventually reach it, but it was mushy soft from what I can tell, but I'm talking about I could barely get my fingers on there. I'm glad I didn't put those fake nails on like I started to today. I wouldn't have been able to touch it. But I was like barely touching it, and it felt like it was super soft. And TMI moment. Sorry, you're on a LTTTC channel, people. So yeah, I go do a little bit of everything, whatever. Anyway, throughout the day, I have to wipe a lot because it's like, ladies, it's just like the wetness feel. And you're like, yeah, I gotta go to the bathroom and wipe. No spotting whatsoever for days and days now, and just annoying wetness throughout the day. And then when I checked, like I said, the cervix is superbly high, which I'll have to go back and look at Chase's chart, because it's been 11 years almost since I was pregnant with him, and I don't remember if it should be firm and high, but it's sky high. So anyway, if I treat that spotting as actual a period, a cycle, which not my uterus, have you met her? Yeah. If I do, which it truly was nothing like anyone I've ever had in my life since I was 13, and I'm 47 now, that would mean that I am literally right at ovulation time right now. And I would have taken an ovulation test, except for the factor that Mom was in a hurry to get home. And you heard her cussing and fussing on video the other day if you watched it. So I got her to stop at Walmart and got the Wally World test. And I was not going to push the issue to go to the Dollar Tree to get the ovulation test, because that was on the opposite side of the street in rush hour traffic in another plaza. So I will get that one tomorrow and take it and use today's urine, because I have seen it. It's right there. And I'll probably get 2 of them. That way I can do another one for tomorrow as well. Why not just use one tomorrow, Jen? Because if today is the dark double line day, I don't want to wait till tomorrow and do one in the afternoon and find out that test is just lighter than the control. Because then I'm confused about the fact of, is it going down or is it just coming up to ovulation kind of thing, So I can compare it to today's urine. You can have urine sit out for 24 hours or so, and it's not going to lose. It's not like it evaporates into the air. There goes the HCG. There goes your hormone levels, Anyway, yeah. Somebody online, I think it's Pee on a Stick Mama or some craziness. I've said it before. I don't know. Pee on a Stick Addict or something. She has a YouTube channel, and she does all kinds of crazy tests. Crazy tests with pregnant urine from her friend or herself, and also non-pregnant urine with other stuff. And she did actually leave urine out for, I believe, 10 or 11 days. and went ahead and tested with it and got the exact same strength lines on the test, the new test, as she did on the old test. So clearly it didn't lose any of the HCG, and I don't know if she did it on an ovulation test, but tis what it is. I want to have something to compare. I like to have things to compare people. I got a science mind. Anyways, enough of this video. Like, subscribe, hit that notification bell. I will see you guys in the next video of Jenn Crazy to let you know what's going on. And I am wearing my husband's ice cream shirt. Yes, this was his shirt. Pink with ice cream cones. He's a man's man. What can I say? He's not at all fazed by wearing this walking down the street. But he said it's too tight because it shrunk when it went in the laundry. Oops, my fault probably. So I wear it, and it's actually not at all tight on me. So I'm gonna get back on the phone and start editing this video, and then I gotta figure out where the hell everybody is that's supposed to meet me tonight, because I need to get going on these errands that I'm supposed to be running tonight, and it's getting late, like 8 o'clock-ish late, and I don't want to be out till like 3 in the morning trying to get this stuff done. Anyway, see you guys on the next one.